Well, March is Brain Injury Awareness Month, a national effort to educate the public in identifying serious injuries in order to get them treated as soon as possible. Here with tips for a faster recovery, neurosurgeon with UT Health and Memorial Hermann, Dr. Ryan Kitagawa. Welcome, doctor.
Thank you. Thank you for having me.
So during this Brain Injury Awareness Month, what do you want the public to know? Because brain injuries are very complex, and I can imagine every situation is totally different.
Oh, absolutely. And I think one of the important things to understand is that brain injury is not just one disease. It is a broad spectrum of diseases. When we typically think of brain injuries, we think of the most severe, things like gunshot wounds or major car accidents with patients in comas. And what we really need to understand is that brain injury is a huge spectrum of diseases. We're increasingly understanding better about things like concussions, which, although is a mild form of head injury, is absolutely a brain injury that can have some pretty significant consequences along the way. So it's not just one kind of disease, it's many kinds of diseases. And recognizing that and recognizing what could potentially be a head injury is actually quite important.
And we're seeing on the screen right now, doctor, some of those traumatic brain injuries, things that would, cause harm to the brain. There are also non-traumatic injuries. Can you give us some examples of those?
Well, of course, absolutely. There are many different things that can cause injury to the brain itself. Stroke probably being one of the most common kinds, and that is a lack of blood flow to the brain that inevitably injures the brain. And that is something that recognizing a stroke is absolutely essential, because early treatments of stroke can really have a huge difference in the long-lasting effects of stroke. But as you see from that list, there are many different things like infections of the brain that can certainly have long-lasting consequences. And of course, other things like we hear ruptured aneurysms, meaning that the bleeding of some of the blood vessels in and around the brain itself can certainly have devastating consequences. So it doesn't necessarily have to be a blow to the head that can have long-term effects.
When we talk about, you just mentioned a blow to the head, a traumatic injury versus a non-traumatic injury. Is the bottom line takeaway here, doctor, that early treatment is critical? Seeing a specialist immediately?
Absolutely. I think the biggest takeaway point is early identification of that, and then an understanding of what constitutes sort of a mild type of injury versus what constitutes something pretty major. So, a blow to the head accompanied by a little bit of headache is usually more of a mild type of injury. But obviously a blow to the head that leads to loss of consciousness or something major like that, an alteration in someone's thinking and cognition, certainly would trigger early identification. In terms of a non-traumatic brain injury, something like a stroke, if suddenly somebody stops speaking or stops moving one side of the body or the other, that's something that very early identification should mean an emergency to bring the patient to the hospital right away. As we have better and better technologies, we have better and better ways to prevent the long-lasting effects of a stroke, to potentially even take something that is as major as not speaking and not moving and recovering that function if you can treat it quickly enough.
And Dr. Kitagawa, we're just about out of time, but you just mentioned it may seem extreme if someone's not speaking or they're demonstrating other signs, but the important news is there is treatment available.
Yes, absolutely. As technology becomes more and more advanced, we're becoming more and more adept at treating these things. The technology for stroke has come an extremely far way to be able to prevent these problems. In terms of traumatic brain injury, our management of brain swelling, and the new technologies that are on the horizon, things like medications, things like stem cells, are offering some really exciting things for the future.
All right, Dr. Ryan Kitagawa, thanks so much for your time.
Thank you.
And if you would like more information, you can visit memorialhermann.org/brain-injury or call 713-704-7100.